I had originally developed my ideas for this topic of challenges of measuring intimate partners' psychological abuse when our center was planning a lecture series by our faculty regarding general problems or challenges to conducting research in the area of violence against women. I had been thinking what would be a good introduction into this topic that lays the foundation for a series of lectures that would hopefully increase the sophistication of researchers, practitioners, and general consumers of literature in the field of violence against women. For years, I had been researching how people, professionals and laypersons alike, thought about psychological maltreatment in intimate relationships. So coming up with a presentation about this issue seemed timely, but then I wondered, would a talk on potential problems, challenges, or significant difficulties when conducting research on violence against women be welcome? I'm aware that this is not a neutral topic. There are certainly fields of inquiry for which the researcher can conduct their studies, and they don't have to worry so much about the impact of the research. For example, somebody doing tissue research might not have to explain to other researchers in the area why they didn't find a particular hypothesized finding, or they might not have to worry, researchers might not have to worry about different percentages that a particular disease shows up in dogs, for example. A lot of researchers get to deal with facts without needing to worry about what it means, or that the research might actually be used against the very aims that the research is attempting to enhance. But we're studying violence against women, trying to measure this wide-ranging and distressing social problem. And many people would say, measurement be damned. We know there's a major problem in existence, so let's just gather the information to demonstrate this problem. But conversely, others would say, well, the quality of the researched information is exquisitely important for presenting our best case to others who are tasked with societal change. So with these competing pressures in mind, I'm going to delve into what I have found to be a murky area in which to conduct research, but with hopefully some ideas for how we might think about or enhance our work in the area of psychological abuse in the future. We all know that science in general has developed scientific principles regarding how to use measurement to provide information about a phenomenon. And therefore, developing methods for measurement was an important early focus for many professionals in the areas of violence against women and intimate partner violence, who were motivated to document the frequency with which various forms of violence against women took place. What better way was there to focus a spotlight on this societal problem than to present scientific data showing how frequently women were victims of various forms of violence? Quickly, however, this initial goal of measurement to document prevalence of violence against women was expanded to other worthy purposes. People trying to identify causal factors, risk factors, and/or prevention factors that would have far more reaching implications for developing intervention and prevention programs. So with such important goals and good intentions of professionals to accomplish these goals, it seems almost heresy to critique the measurement strategies of violence against women researchers. Nevertheless, measurement in this field is often problematic, at times resulting in contradictory findings or not allowing for definitive statements. Differing percentages or opposite findings presented by researchers have been treated scornfully by media or used against violence against women issues by making it appear that research in our area just hasn't quite gotten its act together and the data coming out of the field can't be trusted. One thing that you'll hear over and over again, if you go to present information of, say, your particular university and how many students report having been sexually assaulted during a school year, the most frequent question you get from reporters or other researchers is, why are your numbers different from other sources? On the other hand, some people who really want to sensitize policymakers and lay people alike to these significant issues make deliberate choices. They kind of cherry pick which data they report or highlight in order to support or promote a particular stance. Probably more often, though, people utilizing data from intimate partner violence literature may be unaware of potential problems with developed scales, interview strategies, statistical approaches, or even interpretations of data when citing findings in the literature that you read. Unfortunately, there are fallacies that people may hold about intimate partner violence measurement that with some basic understanding would allow them to be more critical consumers of the research area. The word critical is meant to imply that a person will bring an evaluative filter to his or her reading of this type of source material in order to make judgments regarding the relative quality of research studies so they can select the best ones on which to base conclusions. So if you are a more sophisticated consumer of research, that does not imply that you hold impossible standards for research in this area, because intimate partner violence research cannot attain the most rigorous requirements of experimentation, such as the government might require when testing the efficacy of new drugs, or certainly we're thinking now about vaccinations. When women's lives are being studied, we typically cannot apply the same standards as experimental research protocols, because typically we're making assessments after violence of some form has taken place. Also, a researcher would never place a person into an experimental condition where violence would occur in order to compare them to someone in a parallel control condition where violence didn't occur. So, rather, a critical consumer of this research and this literature knows the difficulties and pitfalls of research and measurement, especially for understanding violence against women and intimate partner violence, and is therefore able to make reasonable interpretations, but still avoid using flawed studies when making assertions. The goal of this presentation is to raise the critical quotient for those wishing to read this literature in the most effective manner, as well as for those planning to conduct research in this area. And to accomplish this, I'm going to begin raising and addressing a couple fallacies, both general to social science measurement, but definitely specific to intimate partner violence research. These fallacies stem from such issues as whether definitions exist for types of intimate partner violence, whether there's agreement about the definitions, and whether we can measure all forms of intimate partner violence through similar methods. Thus, I will be focusing on the narrower picture of intimate partner violence and even more comparing psychological abuse to physical and sexual violence rather than the broadest spectrum of violence against women in order to best illustrate the points that I hope to make. Now, I do want to make one note. You'll hear me use the terms violence and abuse that seem interchangeable. What may be important to know is that in the literature, violence is usually reserved for physical and sexual actions, while abuse is more likely to be used in reference to non-physical, or in this case, psychological actions. So, problematic assumption number one, most people agree on what constitutes violence or abuse in intimate partner violence. Now, I'm sure I could give you a particularly horrendous behavior that everybody would agree is an absolute violation of the norms of interpersonal and intimate partner violence. For example, one spouse threatens to kill the children if the other spouse does not comply with demands. We'd all agree. However, there can be substantial variability that suggests disagreement when researchers or practitioners label actions as abuse or violence, especially when the types of behaviors you're talking about, they seem on the less severe end. I hate to even use the word mild, but if you're trying to say it's abuse, but it's mild abuse, moderate, severe, I think you understand the continuum that we're talking about. Laypersons also disagree. Now, professionals, we're talking about researchers, educators, demonstrate the most consistency when labeling behavior as violence or abuse when they're confronted with individuals who use physical force toward their partners. Among mental health professionals, practitioners, advocates, there seems to be consensus that any use of physical force should be labeled violence. But you start to see some disagreement exist when you're trying to label actions of individuals who threaten to use physical force. Is threatening violence, or would you call it abuse? Or do you just talk about it as threatening to use physical force? Or how about someone who performs really intimidating physical actions near their partner, like they might hit a wall right next to the person? Now, right away, I will caution you, this is not to say that these are not problematic behaviors. They certainly are, but literature you read will sometimes include these in counts of physical violence and some will not. So right away, you can see how you might get a lot of percentages different, quite a bit different in some studies, the ones who include it and the ones who do not. Then we have some researchers who have suggested, if you use physical force toward your partner in self-defense, that should not be counted on these checklists as a violent action. But there's been no agreed upon criteria for helping a person screen their own actions to determine whether or not their potentially self-defensive use of force should be developed on a survey. How do they decide when we're saying, well, what did you do physically? Should they report it or not? For example, how clear should it be to you that the other person is going to use physical force against you before your use of force can be considered self-defense? And further, we find that different patterns or characteristics of participants, for example, gender, may influence whether physical force is labeled as violence. If a woman does it get the same label as if a man does it? Now, I know right now you're thinking about the greater impact of women on physical violence than men, but pull your thinking back for a minute to the idea that we're putting on a researcher's cap as to how literally to measure it, so that if we want to find out other information about it, we want to feel like we've accurately measured it. Another example to consider is the more, I would say, unfortunately, common use of milder physical behaviors such as slapping or pushing. That's documented in young couples who reciprocally do these things. It tends to recede with maturity, but you'll find that professionals are not as quickly, they won't as quickly label this violence. A term that's often used for that is couple conflict. It's certainly seen as problematic for handling interpersonal issues, but it's not viewed as the terroristic violence by some perpetrators. And some people feel it's important to make those distinctions. But I think you're starting to see some of the problems, numbers being influenced by other factors. Now, when we turn to sexual intimate partner violence, deciding what is violence for adult sexual behaviors has been determined mostly by criminal statutes, which define sexual assault. And with those well-established criteria, it would seem that assessing sexual violence would be relatively easy, especially when sexual assault is committed by a stranger. However, coming from a different angle, researchers concerned about obtaining accurate rates of sexual assault have been cognizant that women who experience sexual assault in their intimate relationships may not recognize or may not label it as assault or violence. Some women report they believe their partners have a marital right to have sex with them against their will, or they report because they have consented to sex in the past in a relationship, their partners have the right to sex currently. So we might worry about some serious underreporting in this area. For sexual behaviors or behaviors surrounding sexual activity, which do not fit legal criteria of violent sexual assaults, but appear offensive or problematic, it's much more difficult to define or produce consensus regarding behaviors that fall below a criminal threshold. These are things that people sometimes refer to as sexual coercion. Your partner begs you or hassles you until you give in. Your partner threatens to withdraw emotionally from you unless you have sex with them. And the dialogue around this is just beginning for researchers who are attempting to distinguish lower threshold sexually coercive behaviors, but ones that seem more abusive, from controversial examples of partners who seem to be problematic, boorish, inept, annoying, and that gets to be a very difficult distinction to make. And in these new attempts to define sexual abuse within adult relationships, researchers also have to avoid the pitfall of classifying differences in partners' sexual preferences as abusive, simply because one member of the couple finds the partner's preferences objectionable. So for example, a man who does not like oral sex, but whose wife continually hassles, belittles him until he engages in it with her. How do we classify that? It's a preference. So once we move over to psychological intimate partner violence, it's not surprising that trying to determine some kind of consensus among professionals for which psychological actions constitute abuse is even more difficult than when we're talking about the areas of physical or sexual violence. The literature abounds with descriptions of psychological behaviors that someone has considered abuse, but practicing psychologists, in a study that I did, don't always label those as abuse in and of themselves, especially milder actions or those which could be a result of someone who's pretty inept at interpersonal relationships. Like, for example, frequently interrupting the other person or pouting to get one's way. Psychologists sometimes think, well, maybe this is a person who isn't good at a relationship, but I'm not sure I would automatically call it abuse. Also, certain factors, for example, the frequency with which behaviors are displayed, the intentions of the person engaging in the behavior, also seem important for influencing psychologists' willingness to label such behaviors as abuse, so that, again, a behavior might not be viewed as abuse in and of itself. If you just give someone the description, they might say, well, I would need to know that this happened a lot, or I would need to know what the person doing it intended, what they wanted to happen in relation to that. Are they trying to harm their partner? A study that I conducted found that certain actions were more likely considered psychological abuse when exhibited by a husband toward a wife than when a wife engaged in those same actions toward a husband. A phenomenon which you would not expect to happen if we think a particular behavior in and of itself is abusive. But psychologists, I'm emphasizing that, appeared to endorse some stereotypical sex roles, such as viewing a woman monitoring her husband's behavior as less problematic than the reverse. And they said, well, I guess you're thinking maybe women should check up on what men are doing. But if men did it to women, they said that is really a problem. They also felt that some actions by a woman wouldn't have the same negative impact as the same actions engaged in by a man. And again, an example for this is if a woman controlled her partner's decisions and actions, they view that as less problematic than if a man did that to the wife. So now we're finding even gender influences how people are labeling behaviors as whether or not there's psychological abuse. Interestingly, lay persons were more likely than psychologists to consider behaviors that their partner did that hurt their feelings as abuse, where psychologists were less likely to do that. I think they thought those were probably like poor relationship behaviors, but not necessarily abuse. Where psychologists are much more likely to label behaviors indicative of severe jealousy as abuse, whereas the lay people were not. And we haven't even begun to bring in cultural variations. So from a wide range of studies and writings overall, what constitutes psychological maltreatment seems more to be in the eye of the beholder unless it occurs at the severe end of psychological cruelty, where it would be shocking if someone did not think the behavior was abuse. For example, you refused to let your spouse ever see members of their family. People would agree that that was abuse. So therefore, consensus has not been achieved in this area regarding definitions or conceptual anchors for why or when we would definitely classify a range of interpersonal actions as psychological maltreatment. And clouding the issue, psychological maltreatment occurs reciprocally more often than other forms of intimate partner violence, which can confuse an assessment of who is the victim and who is the aggressor. So with this very brief intro into whether there is agreement as to what constitutes the different forms of intimate partner violence, what might we take from this? The main issue that I think needs to be considered is that the term abuse is not a scientific term, but rather a societal judgment that behavior has surpassed an acceptable threshold of interaction into deliberate attempts to harm. Now, it's not wrong for a society to make such judgments. And some of these judgments you see actually showing up with legal implications where unacceptable social conduct, certainly physical violence. It's also not wrong for individuals in terms of what they consider abuse in a relationship, if they personally have their own ideas. For example, a woman's sister told her that she thought her husband was being mildly abusive to her because of an incident in which the woman wore sunglasses and they had a label turbo. The husband would tease and say turdo. Now the woman, the wife, thought it was funny, but her sister said, I think he's being abusive to you. But people can do this. People can have their own ideas of what they think is a threshold. But asking science to determine a specific threshold for murkier behaviors occurring with intimate relationships is not only asking science to make moral determinations, but can result in significant errors when science goes about trying to apply such a threshold. So consider this example. A psychologist decides that she's going to develop a questionnaire and she lists 30 behaviors that have been identified in the literature as being psychologically abusive. People have said they are. And she assigns weights to the item. She takes the 10 that seem milder and she gives them a score of 1. She takes 10 of the behaviors that seem more moderate and scores them with a 2. And 10 of the more severe get a score of 3. Now, a person completing this questionnaire of 30 items is told, mark down whether or not your partner ever did this behavior towards you. And the psychologist is sitting there thinking, there's a potential score of 60. But I'm thinking, since they've all been labeled psychological abuse by somebody in the literature, I'm going to say that a score of 15 would indicate that the marital partner was a psychologically abusive person and the person filling out the measure had been psychologically abused. Now, right away, you can start realizing that any kind of combination of the scores of the milder, moderate, and severe ones could give you a score of 15. So you could have someone who is doing 10 mild and a couple of the moderate. You can have somebody who just does 6 of the severe. So right away, you're going to get a lot of variability of people who could get a score of 15. Now, a different psychologist is getting ready to conduct a psychological evaluation with a person in the process of divorcing their spouse, and hears about this measure of psychological abuse and says, okay, I'm going to put this in with my group of measures to see if I can, if this person might be psychologically abused. The person filling it out receives a score of 23. Now, would that psychologist be justified in testing in family court that the person she evaluated has been psychologically abused by their partner, or that the person's spouse is a psychologically abusive individual? And should a judge make decisions about granting a divorce on grounds of mental cruelty, or when assigning common family assets based on that score, which the psychologist says meets a threshold of psychological abuse? Here are some of the things we have to consider for which we have no basis of knowing. First, we don't know whether those behaviors included on the measure truly tap the concept of psychological abuse. We don't know, secondly, whether these behaviors occurred only once or more often, which might influence a professional's interpretation of the results. We also don't know whether it's legitimate to establish a threshold score for which we're stating that we can scientifically determine when someone has achieved the status of being abused or being an abuser. And fourth, we don't have a basis for knowing whether the person completing the questionnaire interpreted the questions correctly or accurately how they were meant. Further, knowing that there's a chance the person completing the measure might harbor problematic motives, for example, wishing to portray the partner as worse than they really are, we quickly realize the scientific quandary is present in trying to apply our research methods to an area of interpersonal interactions often lacking in clear definitions and parameters. Our research goals may be better met if we avoid applying societal labels to scientific endeavors when we are seeking to better understand this darker side of interpersonal functioning. We lose nothing by focusing on data and research findings without applying moral designations of severity that cannot be judged scientifically. That is, researchers can assess milder, moderate, and more severe behaviors within various forms of intimate partner violence while avoiding ethical or moral determinations of when a level of abuse should be applied as researchers to the occurrence of particular behaviors from a measure, the combinations in which these behaviors occurred, or the frequency at which they were manifested. But I hope right about now you'd say, well, how do we conduct evaluations? How do we conduct evaluations of perpetrators or victims? Well, it's interesting. Clinicians can conduct evaluations without needing a specific measure that designates a threshold. Science is not hampered by avoiding labels because intimate partner violence and violence against women can be measured in a way that represent the continua of behaviors, which then can be used in conjunction with other factors to learn what important associations exist at these high, moderate, lower ends of the spectrum of intimate partner violence. More importantly, knowing that professionals don't work from a universally agreed upon definition of abuse and violence, it's incumbent upon the consumer of literature to carefully read how an author defines the type of abuse or violence that is being researched. What is the measurement device? How is it scored and interpreted? How broad or restrictive is the definition? Now, by doing that, by having a critical approach to looking at how the researcher is defining things and interpreting things, you're not making a moral determination that the researcher is too lax or too strict in their defining of intimate partner violence, but rather knowing the answers to these questions are necessary for developing this critical lens for which you can then compare researchers' methods, results, and conclusions. You can compare this particular researcher's findings to other researchers' findings. And by being able to make those important comparisons, you come up with a much clearer idea of what is probably the most accurate information. Or at least you can explain why the differences in the measurement occurred. The second problematic assumption that I'm going to address today is that because we are measuring behaviors, we can easily and accurately document the existence of abuse and violence. Now, keeping in mind the difficulty we've already talked about in confidently determining which behaviors clearly constitute the major forms of intimate partner violence, the idea that we are measuring accurate numbers of distinctly abusive behaviors can be quite misleading. Two major strains of thoughts have been introduced since our initial attempts to measure intimate partner violence in the 1970s, which suggest that our accuracy might be questionable. The earliest approach was a structured checklist where people reported how often particular physically forceful behaviors toward an intimate partner occurred, or you might also report on the things that you did. So this was a man named Murray Strauss, and I give him a lot of credit for his pioneering attempts, but we've had to move beyond just that straight checklist. But there would be things on that list such as slapped, pulled hair, beat up, things like that. That measure of his was quickly met with concerns that when you have a checklist of physically violent acts, which people read and report on how many times it occurred in the last year, you're missing the context and you're missing the outcomes, which have been found to very much influence the interpretation of the behavior that occurred. So context is really important, and several major contexts have been proposed that seem to have the potential to alter reported numbers of physically violent incidents. The first context involves ascertaining that when you just list something, that the physical action you list was meant as a hostile or harmful behavior, so that only harmful behaviors, physical behaviors, would be reported and counted. Now you might say that seems strange. I mean, physical violence, physical force, what do you expect? Well, it's interesting. When you consider the range of physical behaviors engaged in by couples that are done in a joking manner or a fun interaction, this screening makes sense. We know that couples playfully wrestle. They engage in playful physical dominance, even as foreplay. And they use gestures such as a gentle punch on the arm to emphasize something that was said. So some researchers have started to include in their instructions to, if you're filling out this measure, don't count behaviors that were done in fun or playing around, either by you or your partner. Most researchers do not ask their respondents to make this distinction. And without this type of instruction, research has demonstrated that rates of physical incidents reported by males as inflicted on them are inflated over rates reported when males are not told to include incidents done by their partner while joking or playing around. So in other words, research by Sherry Hamby has demonstrated you find significant differences in reported information. It's an important context. The other major context that I briefly mentioned earlier that may influence accurate counts and championed by some researchers is whether or not you divulge the use of physical force that you perceive either you or your partner used in self-defense. The issue appears to be that researchers may not want to label a person a perpetrator who used physical force against a partner out of necessity to protect themselves. Historically, the use of self-defense has been very carefully defined in law, and it requires an action that was committed because it was necessary, and I'm going to emphasize necessary for your own safety. So if it were determined that this is an important distinction for collecting research data on physical violence, researchers would have to insert this layer of judgment for the person to use in deciding not to report their own use or their partner's use of physical force if the belief that it was done in self-defense. And as you can imagine, the potential complicated criteria, as well as reliance on the respondent to make an unbiased judgment, quickly makes a researcher concerned about reasonable data collection. I don't know if any of you have ever looked at the law regarding criminal self-defense. There are many, many criteria that you have to pass this threshold before they'll allow you to be found not guilty by reason of self-defense. And to confound matters further, if self-defense were extended to include situations in which you perceived that someone was intimidating you, you thought that they might be physically dangerous to you, how should researchers categorize your actions if you preemptively hit the other person while believing you did it in self-defense? So this area, this context of self-defense is still not very well delineated or thought through by people researching the area. The other important area we have to think about is, what about the outcomes of intimate partner violence? Sherry Hamby has recently focused a lot on the context of outcome, which she has found to be a better explanatory factor and predictor than merely counting the occurrence of physically forceful behaviors. She has gone into literature about women's violence and looked at not just women's rates of partner violence, but also their criminal behavior, delinquent behavior, their behavior in distressed couples. And she essentially believes that women's rates of partner violence are in line with other base rates for female violence. And she has made a very strong argument that women's aggressiveness is not much higher or much lower in intimate relationships than in these other areas of indices of aggression. In fact, she concluded from a multi-method analysis of estimates for the incidence and prevalence of intimate and sexual aggression that behavioral checklists produce results that are not consistent with research findings using other methodology. And because of that, you've got to remember that this is the primary way, the way that she is criticizing the behavioral checklist is the primary way that researchers have been collecting data about abuse and violence in intimate relationships. And she has some interesting ideas from her research why data from checklists seem inconsistent with these other sources. She posits that any physical abuse measure that does not collect data on sexual assault behaviors in intimate relationships is omitting highly significant data. She believes sexual assault behaviors should be included as physically violent behaviors, which she thinks is a more accurate indicator of just straight things like hitting, pulling hair, things like that. She also has suggested, more importantly, that collecting information on the outcome of injury resulting from physical force is critically important information for understanding gender differences. It's universally agreed that men inflict injury against their intimate partners more than women, and that outcome is critical. An international study of dating violence indicated 4 times more men inflicted injury than women, and the infliction of severe injury showed a discrepancy of 7% of males versus 0.6% of females, less than 1%. Hamby has also conducted studies demonstrating that if you measure fear of a dating partner following these incidents, it's highly discrepant when reported by a female physically victimized by a male partner versus a male partner physically victimized by a female partner. And she also believes we need to do a lot of other research on other impacts and outcomes resulting from physical violence, psychological, social, economic, that she also thinks would better demonstrate gender differences when physical force is used in relationships that are not revealed when individuals respond to checklist formats to assess intimate partner violence. So more so than for physical violence or sexual violence in intimate relationships, context would seem to be extremely relevant for understanding whether events are indicative of psychological abuse, beyond, again, what we say, those egregious acts that appear unjustifiable to any observer. One study that I worked on, college students responding to a measure of psychological aggression, it included a wide range of actions, reported that they perceived only 10% of the behaviors they said had happened to them, did they consider them to be abusive. So what that means is they might have said behavior X occurred 10 times, but then they were asked, of those times that it happened to you, how many times would you have called it abusive to you? And they said, well, 1. So 10% of the time. And this is an average across their reporting of all these behaviors. So, oh my goodness, how do we explain this? It is likely the context in which those behaviors occurred influenced the recipient's perceptions. Thus, it appears that certainly some psychological behaviors that are briefly described on measures in which researchers have labeled as psychological abuse for inclusion on surveys can occur in ways and contexts that people don't consider serious violations of intimate partner behavior. Do people always think, for example, that if your partner yelled at you, that it was abusive? One possible way to address this would be to collect the subjective reaction of respondents when they indicate that a particular behavior has occurred. Another context to consider is whether an abusive behavior occurs within an exchange with both members of a couple participating in psychologically aversive behaviors. One thing I think of is if you're both doing it, do you end up interpreting it differently than if one person is doing it to the other? But think of these reciprocal psychologically aversive interactions that can range from less problematic actions like swearing, rudeness, some attempts to hurt people's feelings, expressing contempt, all the way through more serious serious transgressions of intimate interactions. If they're happening on a reciprocal basis, it makes it difficult to know whether you, as the respondent completing a measure asking for your relationship history of psychological aggressiveness, should report a partner's abusive actions only if you did not initiate the exchange. Or we'd wonder whether you should still report being the recipient of abusive actions, even if the partner reciprocated in kind, or whether you as a respondent should be considered a victim, a perpetrator, or both. Thus, the reciprocity of couples using psychological aggression as another contextual factor that can influence whether behaviors are reported by research participants and whether researchers are underestimating or overestimating counts of psychologically abusive behaviors, especially if the researcher does not know respondents' subjective reactions or the reciprocity of the actions. Although much of this discussion has concerned potential over-reporting, other major developments have called into question whether we can know for sure that respondents are acknowledging behavioral occurrences of abuse or violence. Pioneer in this area is Mary Cost and her colleagues, who working to measure an accurate prevalence of sexual violence on college campuses. They reported that their measurement evolved based on their research experiences. Historically, they started using standard language for sexual assault by asking people about the occurrence of rape. However, when they switched on new measures to assess sexual assault by using behavioral descriptions, often based on legal definitions, rather than saying, were you raped, more women endorsed being the victim of legally defined rape than when they were asked directly, were you raped? And over time, the lesson learned from this area of research has been that accurate assessment of rates of sexual assault must come from instruments that describe sexual assault in technical, behavioral, and specific terms, because stereotypical elements of rape embedded in respondents' judgments might prevent them from labeling what happened to them as sexual assault. For example, a woman raped by an acquaintance may view rape as only occurring if you are attacked by a stranger in public. Or as we said, a woman who's married might believe her husband has a right to force sex on her. Thus, neither woman would be likely to endorse an item asking if she was raped, but she would be more likely to endorse an item that describes sex that was non-consensual and forced against her will. Another complication, even when specific language is used to describe what we think is abusive behavior, can occur if the language of the measure is value-laden. This, of course, can impact the accuracy of reported data. Here's an example. Different measures of physical violence, when they want to collect information on serious, physically aggressive incidents, might use phrases like beat you up, threw you around. But researchers developing these measures likely envisioned a similar extended physical assault. It's not difficult to imagine, however, that respondents could endorse being thrown around while completing one measure, but wouldn't endorse being beaten up if they perceived a different measure using this technology. This example of the difficulty trying to compare language across scales, even for physical incidents, pales in comparison to attempts to match language across scales assessing psychological abuse when a person's verbal treatment of their partner is being assessed. So imagine the item. Your partner said blank things to you, and think about how you might answer that if you were given the following adjectives. Your partner said spiteful things to you, mean things, nasty things, hateful things, cruel things, abusive things, or horrible things. So first, a researcher cannot be sure whether individuals responding to this subjective language are interpreting the adjectives at the level that that researcher intended. So for example, if they had spiteful, do they mean abusive? Is nasty the same thing as abusive? And second, it's uncertain that researchers themselves know exactly what types of partner statements would fall under each of those descriptors. So the researcher can't be certain of the scientific level that the particular adjective establishes, nor can they confirm that this item of abusive verbal behavior towards one partner matches the threshold of sanctionable actions. That would be what society would generally consider abusive actions. We can predict, however, that different terms across measures would likely produce varying rates of endorsement, and they probably cannot be considered comparable. So any behavioral descriptions given to individuals that contain words that are vague or subject to interpretation by researchers as well as the individuals taking the measure typically raise more problems in interpreting the findings than they contribute to our knowledge in the area. So what might we take away from this information suggesting that documenting violence and abuse is neither easy nor can we guarantee accuracy? First, it seems paramount to understand that having persons respond to simple checklists of negative intimate relationship behaviors may not be the ideal way to provide sophisticated and accurate knowledge regarding rates of abuse and violence. Unfortunately, checklists currently provide much of the data upon which research literature is based, but at least reading carefully to determine whether researchers recognize the potential for inaccuracy of numbers collected through this methodology would be important for understanding the significance they attach to the results. I remember reading an article assessing psychological abuse in high schoolers, in which the researchers were shocked to report that 98% of the students had been psychologically maltreated by their dating partners. Now, I think this is highly unlikely if you really take, put a pretty strong label on maltreatment, abuse. And so I looked a little closer at what were the items that they had. And I noticed they had an item, your partner said something to spite you. Now, I have a hunch that this has likely happened to 90%, 98% of people in an intimate relationship of some length. But labeling that behavior as abuse and that these high schoolers have been psychologically maltreated, I worry cheapens the experience of individuals who have been the victims of horrific psychological maltreatment. The second thing to take away is that behavioral descriptions for sexual violence that fit legal definitions of criminal behavior appear likely to give the most accurate numbers when measuring sexual assault. Third, if checklists are used in the future to assess intimate partner violence, possibly the best use of them would be for screening for abusive behaviors, whether physical, sexual, or psychological. And then if a respondent endorses one of these items, second-level questions could be used to eliminate behaviors for which context suggests that maybe they're not truly abusive incidents, or for which, if you were able to collect additional data, like whether or not there was a resulting injury, what was the severity, how frequency did these things occur, what are the nuances of the behaviors or interactions, that would be much more helpful for understanding more about whether or not something that they're endorsing would typically fall within a severe range that we would be assessing. Fourth, ideally, some basic agreement by researchers in the field of violence against women on some terms and behaviors would be very helpful for comparing studies and understanding what factors influence discrepant data, but I am not holding my breath. And last, clinicians who conduct evaluations that include understanding what intimate partner violence occurred must take great care to not rely on checklists to determine forms of abuse and to not think they could establish a label of abused or abuser based on a score. Rather, excellent evaluations can be conducted through thorough and insightful interviews that will serve the needs of that approach to understanding the presence of abuse within intimate relationships. Now, I hope that this presentation has been thought-provoking and informative and potentially useful for research or clinical purposes. If you have any comments or questions that you wish to direct to me, my email address is follingstad@uky.edu. Thank you.